remind me when the time is. Well, the time is now, Adamu, and I hope that you are with us. Starting in less than a minute for the Global Assembly. And this is also the global event. It's the weekly assembly for participants in the Peer Hub and the Global Assembly for everyone who wants to join us to hear what we have been doing and what are some of the initial outputs for the first 6 weeks of the COVID-19 Peer Hub. See you soon. Warm greetings from Geneva, Switzerland. This is Reda Sadki from the Geneva Learning Foundation, and we are here to invite you to share and celebrate the collective effort of health workers who, despite the challenges brought by the pandemic, continue to work every day to protect children from vaccine-preventable diseases. We have in the room a number of participants in the COVID-19 Peer Hub who have been working together for the last 6 weeks. And then we also have on Facebook a broader invitation. This event we are broadcasting on Facebook Live, and I warmly welcome Eddie G. Giddings Sr., who says, great to be here, as well as Lydia Edia, who says, hello, everyone. Nice to be here. Dr. Tanushri Mandal, who says, great to be a part of the learning process. Thank you, Scholar Team, one and all. Before we go any further, I want to introduce to you three of the amazing individuals who have been leading the Peer Hub in the last several weeks. So I'd like to ask each one to introduce themselves and say what are you feeling, Alain Blaise, Charlotte, and Shalini, as we kick off today's global event, where for the first time participants in the Peer Hub will be sharing some of the initial outputs, outcomes, progress made through participation in this new way to work together. Let's start in the order we see here. So Alain Blaise, Charlotte, and then Shalini.
Yes, thank you very much, Reda. Good afternoon and good morning to everyone. So, Reda, for me, it's a pleasure to be here today. I can say that I'm quite excited. Why? Because we've been working together with all participants in the room to come up with something in the Peer Hub, using all the tool and the environment that we provide to them. So it has been a very interesting experience of providing support on a daily basis. We get to know each other. We saw a lot of dynamic support from scholars to walk through the final line on having that action plan developed. So I would like to say that, first of all, I would like to thank all the scholars in the room here, because we saw a kind of a spontaneous support among us, from new scholars, even alumni. So that was really interesting. So today my expectation is to really hear from them, because now that we've done that, so we would like to find out how that is helping them in their day-to-day work in the COVID response. So yes, I'm here really to listen, but also to acknowledge what I saw as a community of professionals supporting each other to achieve a common goal. That was the action plan. So congratulations to all of it, and I'm looking forward to hear interesting expectation and insight. Thank you, Reda, and thanks to everyone.
Thank you, Alain. A wonderful message from Sohini, who's also in the Zoom room with us, so who's been working in the last 6 weeks, who says it's a privilege to be part of this. Peer Hub has been no different from her previous experience with the Geneva Learning Foundation. This is just the beginning of this huge global family continuing to work together to improve immunization services during the pandemic. Thank you, Sohini, for that message. Many other messages coming in via Facebook. Charlotte, over to you.
Thank you, Reda, and greetings to everyone. I would just like to spring from the message that was just led by Sohini to say over the past few weeks, it's been a wonderful experience, and it almost became like family. Getting in contact with scholars on a daily basis and exchanging with them, listening to them share their experiences of what they were living day to day. They invited us into their world, and they shared with us what they were going through as far as maintaining or relaunching immunization services were concerned within the context of COVID-19. So I can only say it's with great joy that today we are here with these scholars, hundreds of them here in Zoom and over Facebook. And we are looking forward to hearing them tell us about how the whole exercise was for them, how the whole experience was for them, and looking forward to seeing them actually transform their action plans into reality on the field. So thanks once again to all the scholars who have been there and sharing their stories with us. And to you too, Reda, over to you.
Great. Thank you, Charlotte. And now from Dr. Shalini Kare, what are you feeling right now after 6 weeks, the first 6 weeks of the Peer Hub?
Thank you, Reda. I would say that, firstly, I would like to say good afternoon and good evening to everybody, wherever you're joining from. It has been an absolute pleasure seeing all of you in this platform and working together and making this community stronger. And I feel that I have learned a lot from your experiences and what you shared in the fantastic sessions, and how you all, struggled with the pandemic, and yet you made it. So a big congratulations and kudos to all of you. And I'm looking forward to hearing more about your actions, and I'm really, really excited. And I would also like to say that this is the beginning. So I hope that we keep engaging in the future, and I look forward to supporting you all and being this big, great family and this community and doing great things together. Thank you, Rita.
Before we go any further, I would like you to mark a pause and bring your hands together for yourselves, for all of the participants in the Peer Hub. And then, of course, as we said, this is a contribution to what health workers are doing all over the world. So even if your colleagues are going to wonder what you're doing, get ready to put your hands together now. Now, 3,904 participants were selected, and I see the slide is still in French, but I hope that won't confuse everybody. Half of the participants invited were French speakers. You can see here the breakdown by country, so you can see very large contingents. And in next week, we'll be sharing the details of and the numbers country by country to show you how each country did in the Peer Hub is doing so far, did in the first 6 weeks. Most of you were and are Ministry of Health national and subnational staff. So for those of you joining us for the first time on Facebook, I wanted to highlight a few of the characteristics about who is working in the Peer Hub. And thanks to Abdul Sami Khan, Obed Nuobe, Mepak for all of the great messages that you are sharing on Facebook. We are reading not only your greetings, please tell us what city as well as the country you're from, and also ask your questions or make your comments. The majority of folks in the Peer Hub are trying to maintain vaccination services and prepare recovery during the pandemic. There's a number of other health professionals involved in the COVID-19 response that is important to highlight as well. Now, one last characteristic of the folks who started out in the Peer Hub is that the most critical challenge was a reluctance of caregivers to come to health facilities. This was 6 weeks ago. And what we've been exploring is that changing? How is the action being led by scholars and other health workers helping to change that? Now, to give you a sense, especially if this is the first time you're hearing about the Peer Hub and joining us on Facebook, just to give you a sense of what we have been doing together. We put together a new platform called the Ideas Engine. We realized that everyone was having to adapt to the pandemic, to figure out how they were going to keep vaccinating, keep reaching children to the greatest extent possible while ensuring the safety of themselves, of their colleagues, and of the families involved as quickly as possible. Rather than doing that alone, we chose to share around 7 specific themes, ideas, and practices. And within 2 weeks, there were over 1,000 ideas, at which point we shifted gear to focus on the action planning, ending up but people couldn't stop themselves from contributing more ideas, and so we now have over 1,200. So again, I'd like a round of applause just for the creativity, the capacity for invention, for adaptation during the pandemic of everyone who participated in the Peer Hub, as well as health workers all over the world. We did not stop here with a generation of ideas, because following 2 weeks in which we did focus on idea generation, we shifted gears to produce action planning, drawing on the ideas, but about turning them into practice. Now, that's a quick recap you're going to hear firsthand from participants who will be presenting what action they're going to take to adapt to the pandemic, and explaining what ideas and practices they're going to be using. Before we do that, though, I want to go over the next stage of the Peer Hub. We have finished. We are now closing the first chapter and opening the next one. Some of you will be joining the WHO Scholar Level 1 certification in routine immunization activity planning. So for those who will be accepted into this course, you will have to decide whether you want to focus solely on that course or whether you are also going to be continuing in the Peer Hub. Others will also be joining the Electronic Immunization Registry Scholar Level 1 course that we're doing with the Pan American Health Organization. And again, the choice and the responsibility will be yours to decide whether you are going to maintain both engagements or whether you are going to choose one over the other. So we know some of you are waiting for the letters of acceptance or may have already received them. Whatever the case may be, if you applied for one of these two courses, you'll be working with our team. You'll be able to stay connected to the Peer Hub, and you might decide to pass on some of the activities in the Peer Hub in order to focus on your coursework. That again is up to you. So next announcement is that we're going to be holding a commencement ceremony. We believe that the first 6 weeks is literally the beginning of something that we can do together in terms of collaboration and so on in the through the Peer Hub. So that will be held on the 24th of September. Check your emails because you'll be receiving the invitation. And this time, we'd like you to invite not only scholars or colleagues, but you're also welcome to invite your family members who perhaps have observed you dedicating inordinate amounts of time to the Peer Hub above and beyond and outside of your working hours. So we want to include families, friends, anybody else who may have suffered because of the crisis related to the pandemic will be welcome to join this event. Now, a side note, a very practical note, just because I know everyone is here right now, is that if you need extra time to submit your final project, there's a few of you who have been working in the Peer Hub, working on your action plans of projects, and we want to make sure that you don't miss that final submission deadline, because if you do, you will not be eligible for certification for the first phase of the Peer Hub. So that it's very important that you do that. Now, next is that to qualify for the next stage of the Peer Hub, we'll be asking you to complete the Peer Hub Pulse Report 2. So you completed Pulse 1, that was and is a certification requirement for completing the first phase of the Peer Hub. The next one is going to be asking you a lot of familiar questions. We want to understand what's changing, and we also want to understand better your experience of the Peer Hub and how we can improve that in the future. Now, the next deadline, and if you have your calendar with you, you'll be able to get the presentation and the recording and so on after this session, but you might want to write down the 18th of September. Many of you are working in very active country teams, and if that is the case, you don't want to miss the deadline of the 18th of September, because that is when will be your team leader and your COVID-19 focal point will have to submit their first country Peer Hub report, so on behalf of the country team. And if they do not, then we will not be able to recognize your country's team for the Peer Hub. Now, rest assured, if in your country it hasn't worked out, and we know there's a few countries like that, you will be able to fully participate in the Peer Hub as an individual and working informally with people who have not, who you've connected with from your country or from other countries. However, I believe it'll be a much more powerful experience if you are able to come together as a country team. Again, that is in your hands. And if you come together as a country team, you need to be clear about why, and you need to be clear about what you're going to do together and how you're going to do it. Now, the next one is that starting tomorrow with Charlotte and Boo, we will be inviting, and some of you have already received the invitation to present your ideas, practices, and your action plan. Again, with the action plans that you've spent 4 weeks on, you've moved from collecting and generating ideas and practices to actually determining which ones and how you're going to be putting them to use. So we believe that's a very important step, and we'll be doing that. We will be celebrating and honoring the work that you have done in the first 6 weeks of the Peer Hub and sharing that experience, sharing some of the best action plans, the best ideas, the ones that are making the biggest difference as far as we can tell. We're going to be inviting you, and feel free to tell us, hey, I'm actually doing something really interesting with my plan. I'm already moving ahead with country colleagues, with my colleagues at work. So please, let us know if you want to come and tell your story. We'll be doing that with the daily ideas bulletin bulletin, and many of you are live ideas is what we called it before we kicked off the Peer Hub. So that space will be open to you and will be on Facebook. It'll also be shared with Peer Hub participants in other places. But, and the nice thing is if you miss it when it's live, you can go in at any time and watch it and take your time to listen and connect with the ideas. If it's not interesting or relevant to you or you're just too busy, you can also move on. This is not a required activity, but it's really about giving back. You've worked hard for 6 weeks. Now we want to share and celebrate that effort and move as we get ready for the next stage of the Peer Hub. So the next stage is kicking off on the 21st of September. And that is what we call the Impact Accelerator Launchpad. So I'd like to ask you, if you participated in the Launchpad in July 2019, please, and you are in the Zoom room, please raise your hand. If you're in Facebook, please leave us a comment so we know that you were part of the Launchpad that we ran in 2018. What is the Launchpad? It is even less a course than what we've been doing in the last 6 weeks. Instead of focusing on assignments or a project, you're going to take the action plan that you developed and you're going to run with it. And we're going to be accompanying you, walking with you or running with you in some cases, and you'll have your country colleagues and colleagues from other countries, and we'll be sharing the successes, the challenges, the difficulties, and the solutions that each of us may find, and sharing them so that we can learn from each other as we work to actually implement what your Ministry of Health is asking you to do, what your employer is asking you to do. So at this stage, I'd like to turn to Dr. François Gass. He has been with us literally every day in the Peer Hub in the last 6 weeks. If you joined any of the daily sessions, you have probably worked with him, many of you, together with Charlotte Mbou to refine your action plans so that they're focused on being realistic, feasible. I'd like to ask him, François Gass, what is your expectation? If you're able to speak to us, I know you're having torrential rains that may prevent you from speaking. Could you tell us, what is your expectation from the Launchpad? What would you like to say to the scholars who have been working for 6 weeks in the Peer Hub?
Thank you, Reda, and hello to everyone, whatever time is it in your part of the world. I must say that it's been a fantastic journey. And I think what I love most is a journey in my life and journey together, where we learn from each other and we move toward the common goal. And I think it has been a big learning experience for me to be with you and to understand what's your context, what are your main challenge, what are the goal you could set wherever you are, and how you're going to address the goal with concrete action that you can monitor, and when you can monitor progress towards it. And I must say that I've seen progressively, I have the feeling that we were building something. And the end of these 6 weeks is, I think the building is there. Now we have to use what we've built together and make it work and get the result that you set in your goals. And I'm looking forward to this common, I've been with Charlotte, and we were a team, and it worked quite well. We were really happy to be with you during everyday session. So looking forward to hear you today and hear what you have learned, what we could learn from you to do better in the coming weeks. Thank you very much.
Thanks, François. And I know that are you concerned that some people may have developed an action plan and just sit on it rather than act on it, which is the intent? Is that a concern of yours?
I would say, Reda, you touched a very sensitive point. I have goose pimples when you say that, because I'm not from yesterday. I've seen so many plans that have remained on the shelves, and very good plan that could be actionable. So I'm looking forward with this new approach and this joint partnership that we're going to go together and try to make the plan works, and that everybody will be there to help along the path, the other scholars, the panelists, the scholar team. And I think it has a chance to get down to action and to some results. So really, I'm looking for the results, even more than the building of a plan. The plan is the first step. The next step is almost more important than the plan. Over to you, Reda.
Thanks very much, François. And I see that Mohammed Imran Qureshi strongly agrees with you. Mohammed, would you like to tell us why? And I know, of course, you were one of the people very actively involved in the Impact Accelerator Launchpad. Could you tell us, explain for those for whom this will be new, what is the expectation?
Thanks a lot, Reda. And yes, I strongly agree. The reason behind is quite simple. Like over the years, we have seen a lot of like such documents in immunization program, like comprehensive CMYP, like annual plan of action, like so many other documents. And this COVID-19 peer hub exercise is really no more different. Although together we just brought out certain solutions to the problems. But the thing is that if those solid solutions, which we have sorted together, if they would remain on shelves and if they are not implemented, then probably they are useless exercise. Because now the children of the world, they probably need more than ever the immunization scholars of the world to get them immunized and to save them from vaccine preventable diseases. So I would humbly request to all the colleagues that they should like come up and they should like work together. And even if it is not possible to like have the implementation for 100% of their action plans, but whatsoever they are being able to implement, that will be the overall outcome, and it's a better result for the children of the world. Over.
Thank you, Mohammed Imran Qureshi from Pakistan. Now, what we're running through now is basically the next stages for the Peer Hub. And one of the key decisions that will be in your hands is, do you want to continue? Are you going to stop here? Maybe you've had enough. And if so, that is your prerogative. We don't want anyone staying in the Peer Hub who is not ready to, who doesn't actually have their own clear, specific reasons for continuing to work, and they can clearly identify what is the benefit, what is the point of investing the time here. Now, many of you are also Teach to Reach alumni of the Teach to Reach Level 1 certification to improve immunization training. I'd like to ask you to raise your hand using the little raise hand icon in Zoom if you're in the Zoom room, or to let us know that if you're in Facebook, send us add a comment so you can let us know that you are a Teach to Reach alumni. So what's happening next is related to the Peer Hub. I'm going to tell you why, is because we're going to have two events. One will be a pilot conference, 12th to 14th of October. And during that's the last week of the Impact Accelerator Launchpad. And so during these 3 days, country teams that wish to present to other countries and as well as to global partners will be invited to do so. If you want to report back and share your experience in the Peer Hub, what participants in your country team are doing, this will be the occasion to do it. We'll use a brand new platform that will enable us to have a plenary room, rooms for sessions. So each country team will have its own room to host sessions, to present, to share, to discuss, and so on. There'll also be a networking feature where you click a button, and just like the remote coffee, you'll be able to connect with someone else in the Peer Hub, but it could also be someone from one of the global or country partners. And then we will pilot this in October, and then we will have the first Teach to Reach annual conference from the 8th to the 10th of December. And there, that will be another occasion to showcase and share what concretely participants in the Peer Hub are doing individually, and also as country teams for the countries where we actually have country teams in place that are working properly with full support of the national EPI team. Now, next, and this will be the final stage of the Peer Hub for 2020, we all know this is the single most recurring theme, probably one of the biggest threat declared by the World Health Organization, a global threat to public health, and that is vaccine hesitancy and demand. And all of you are on the front lines facing it, figuring out how to respond, what to do, and how to do it. And we believe that as a group in the Peer Hub, you have significant experience, which does not mean you have all the solutions, but it does mean that by working together in the same way that we work together with the Ideas Engine and then with a peer review exercise, we believe that we can significantly support and accelerate the search for solutions, effective methods, context specific, that you and others will be able to use to tackle vaccine hesitancy and demand. And again, we'll be inviting our partners to contribute content and contribute their experience and data and so on to this effort. So that is how we will round out the year for 2020 for the Peer Hub. So we're at minute 25, and yes, I see many Teach to Reach alumni on Facebook that I want to acknowledge here. So I'm going to quickly cycle through their and thank you, Kwame Tete, who says is a proud Teach to Reach alumnus. Sambo Ishaku, welcome. And we're glad that you are with us. I think coming back for more is one of the best ways that we know that we are on the right track. So now, here is the main feast for today. And you know that everything in the Peer Hub is based on your participation. We're doing it for you. We couldn't do it without you, and we want to do it with you. So I'm going to hand it over to Charlotte Mbu, who has been in touch with some of you. Glad, Lydia, Edia, that the sound is back on the Facebook for you. Charlotte, over to you to introduce presenters if they are in the room, and if not, I'm going to lower all the hands, and we will be calling, and Charlotte will be calling for volunteers to answer these very concrete questions about your experience so far of the Peer Hub.
Okay, thank you very much, Reda. And once again, good afternoon, good morning, evening, everyone, depending on where you're joining from. It's a pleasure for me to introduce today a couple of scholars who have gone through the Peer Hub Exercise 1 and have developed an action plan that I've shared with us. And today they have volunteered to share their action plans with everyone. So I'm going to invite Adefunke Adesina to unmute herself. The questions are on your screen. Adefunke, we want to know, the impact of participating in the Peer Hub for you and your specific challenge, the priority challenge and the specific goal that you have set out to implement through the action plan that you have drawn up. So if you are ready, just to say Adefunke Adesina is from Nigeria, you have the floor.
Good afternoon. Good day, all. I'm Dr. Adefunke Adesina. I think you can hear me well. Hello?
Yes, we can get you clearly. Yes,
yeah.
You can get
So
you clearly.
I'm Dr. Adefunke Adesina from Nigeria. I'm the M&E focal person at the Directorate of Healthcare Planning, Research and Statistics, Lagos State Ministry of Health. As per the question from the Peer Hub, the change that the group or the being participated as part of the Peer Hub group, I've really gained a lot of, I've developed my knowledge in immunization capacity through the ideas of other Peer Hub, other scholars in the forum. And I think it's a great opportunity and a privilege given to me by accepting me as part of this Peer Hub group. I really want to continue my plan, my participation in the Peer Hub, because it actually helped. Fine, we always design an action plan. We try to implement it. But for the fact that this time around, we know that we have our target goal and the feedback to the platform, we follow up. I followed it up properly. The challenges I set is that from my own end, there is, as at the time we're trying to check our database and to, from the DHIS at which we use, and there's another device we call the photo tracking system. We discovered that there is a decrease in immunization coverage due to the decrease in demand of the caregivers as a result of fear of being infected with COVID-19 wherever they think if they go out to go and get the immunization. And the goal that we have set to ourselves that we want to increase the demands by having a good communication with the Hello, can you hear? Hello?
Yes,
Loud and
we
clear.
are hearing you. Please go ahead.
Okay, yeah. My goal is that we want to increase this deficit. We want to increase demand in immunization, by the caregivers, by getting in contact with the immunization stakeholders. When I say immunization stakeholders, it starts from the scratch to the top. From the scratch, who are the World Health Community people that we always use to get in contact to one-on-one people in the community, because this community World Health Chairman, World Health Group, they are from the grassroots. They have the link, they have their way to each family. In fact, they themselves, most of these mothers are their wives, of their children, their wife of their relatives. So they have their way of linking their community. They also have their way of linking their traditional people to talk to their people, to use all their community activity to sensitize, to encourage their people more on what they should do. Now, and after that, there's what we call consultative forum. Consultative forum, this always organized by the states. In other words, these are the avenue at which all the stakeholders in different aspects of life, when it comes to the CSO, the community societal organizations, other health-related sectors, where we come together, religious leaders at the state level, at the regional level. There's what we call Ibiles zone in Lagos State, where the political zone is divided into 5. So all them together to hear from them and also to hear from the government. What exactly do they need from the people? How can we do what we have actually planned in our operational plan? How can we get it across to the people? So it's one of those things that we set as our goal. And the concrete action that we have taken is we made sure that after analyzing our data, we try as much as possible to get all what is needed. Talks in terms of skills at both our own ends and at the community ends. We try to organize training, both virtual due to the ongoing COVID issue. We try to organize both virtual. Those we think that we cannot meet virtually, we get to them by getting to each local government, each ward, through their health community people, to sensitize them on how they can protect themselves through the basic IPC, infection prevention control, how they can prevent themselves in order not to be infected, whether they are going for immunization or something else, how they can prevent themselves. Luckily for us that at least to some certain extent, we know the mode of transmission of this infection. So we try to get in contact to them, and we train our workers, the healthcare workers as well, in order to build their confidence. At least at a point we discovered that it's not even all about the IPC alone. It's all about the psychological, but we try to let them know that this and this what they could gain if they can follow strictly the basic IPC procedure, hand wash, maintaining physical distance, maintaining a physical distance, use of hand sanitizer, that is where you don't have an access directly to a running tap, then use of face mask. So those are the action. We didn't only stay at this level. We try to follow up whatever anything we're doing. We get a checklist to see how people are coping and how are they really doing what we said to them. And aside this, we try to check. Aside this, we try to follow up with our DIHIS tool to see the reporting, the feedback they are getting. And we always make sure that we organize regularly the review meeting to hear from them the challenges. We don't stay only at this. We try to do what we call ISS, the supportive supervision, to check, to hear from them, to let them know that nobody is picking anybody, nobody is policing anybody, but we're just there to support you, to hear from you. What are the challenges, what government can do for you? So these are the things what we try to do. Then, how can the peer hub carry out these actions to reach your goal? Well, the peer hub can help by getting in contact, maybe probably if I feedback what are the results we're seeing based on those our actions. If they still have an idea, fine. But as we all know, the government may not be able to do everything. Sustainability is key. We try to choose those activities that we think we'll be able to sustain. But meanwhile, we know that government cannot do it all. Government may still need support from partners who can assist in how to supply basic needs that people can be used at the grassroots level. Thank you.
Okay, so thank you very much, Adefunke, for sharing your experience with us. And I rather just pasted the questions on the chat. So if you are not able to speak today, you can still type in the answers to these questions on the chat. And I want to thank all those that have been leaving comments on the chat and on Facebook concerning what they have heard from Adefunke today. And I also want to take advantage to say happy birthday to you, Mohammed Imran Qureshi. Right now, I'm going to invite the next presenter for this session. It's Atayi Abubakar, also from Nigeria. So Atayi Abubakar, you are going to unmute yourself and then you have the floor.
Yeah, good afternoon, good evening, good morning, depending on where are you. You can hear me?
Yes, we are getting you. 5 and 5.
Yeah, I'm Atahiru Abubakar by name. I'm working with National Primary Healthcare Development Agency as a technical assistant with Zamfara State Government on round 2 immunization. What has changed my mind through participation on this hub? This hub has made me change my way of thinking and collaboration with people. I was able to learn a lot, seeing that working together, I can achieve more than what I can do alone, and we're able to support each other and move forward. Based on my challenge that I'm working on, that is making PPEs available to hard to reach communities where it is affecting routine immunization. I was able to work with some colleagues here in Nigeria that we are able to meet some private part organizations that have started supporting us, and we're able to meet the COVID-19 coordination group, a coordinating center in Zamfara State, where we're able to be supporting some of those hard to reach areas with PPEs material. Definitely, I plan to continue my participation in the peer hub because that's an avenue where we can exchange knowledge, build capacity, improve on all ramifications in immunization. We have been able to learn from other countries how they were able to improve their immunization coverage, demand generation, based on this COVID-19 pandemic. So, which have been applying it similarly in where am I, and I'm seeing a result. So what is the challenge and goal I have set? As I said earlier, my goal is to see that PPEs are available in hard to reach areas where caregivers and health care providers will be accessing it for free without any cost, because the cost of PPEs is making some caregivers to be sharing PPE face masks. They will sit down by the side of the facility. One will use a face mask, go to the facility, immunize her child for those that are conversant, then come back out, give the same face mask she uses to another caregiver to go into the facility to assess services. So making the PPEs free and available in all nooks and crannies is my goal, which is in line with our EPI objective. The concrete objective I have taken so far that I want to achieve my goal is liaising with a lot of partner organizations in my state and outside the state, and a lot of private organizations that are willing to provide a little support so that PPEs can be available in all hard-to-reach areas and without any amount, which it has to be free. So I want the peer hub to support me. How I want the peer hub to support me is by continuous providing additional information on how we can sustain demand generation during this pandemic in order to make sure all our eligible children are vaccinated and we have reduced the rate of dropout. Thank you very much.
Thank you very much, Atai Abubakar, for sharing your experience. And I believe that among the over 1,200 ideas in the ideas engine, you'll definitely get the help that you need from the Peer Hub. And right now I'm seeing that 3 raised hands among the participants, and in the panel there's a raised hand, and there are more and more comments that are here on the chats in Zoom. Reda, do you have some outstanding comments on Facebook that you want to share before we go over to scholars who have their hands raised?
Just a comment from so many great comments on Facebook. I'm just going to show this one, the latest one, Bashir Ahmad Sabo. It's important to be part of this learning team who had different scholars. I also want to congratulate and thank the scholars and the colleagues on who are following us on Facebook. There's over 200 comments that were posted even before the event opened today. So just want to highlight that, and again commend this very dynamic group. And just very briefly, let me see where it actually is. Yeah. So next stage is we're going to keep. Today is just the beginning. We'll keep recognizing, commending, and inviting you to share your experience, what you've gained from the last 6 weeks with your colleagues, including those who are not in the Peer Hub. Starting on the 21st of September, we'll be going into the Launchpad, where you take your action plan and for 4 weeks you work with others in the Peer Hub but more importantly, maybe perhaps with your colleagues at work to translate those actions that you said you would do, to actually figure out how you're going to do them, and then to actually do them. That's the main point for the coming month. And then several people have mentioned this issue of vaccine hesitancy and demand. So the last phase of the Peer Hub for 2020 will be focused specifically on how, using this networked approach, using the Peer Hub, we can better share experience, what works, what doesn't work, what's the context dependence for the practices and ideas we can use to tackle vaccine hesitancy and demand. So that's, just wanted to remind everyone of that. And I see there's still more people joining us on Facebook. So hello to Abidemi Olatunde. This is a very useful brief from our speakers. And in fact, I suggest we do a round of applause for our speakers so far. All right, Charlotte, back to you.
Right, so thank you, Reda, and thanks to Adefunke and Atai for the great presentation. So I'm going to start from the panel with Mohammed Imran Qureshi, because today is his birthday. So Mohammed, I'll invite you to unmute yourself, and then later we'll go back we'll invite other peers to share their experiences. So over to you, Mohammed.
Thank you very much for giving the floor once again. First of all, I really want to say thanks who have wished me on my birthday. So it's just a special birthday from a special platform. Thank you very much once again. So I'll quickly just wrap up the questions which is in front of me. So, the biggest change which this Peer Hub has brought to us is basically, we believe that is the COVID-19 pandemic is the most and huge public health challenge and immunization program is no more different. Because what I believe, as the COVID situation is getting better and better, but the thing which has got worsened and the persons who have got hit the most is basically the children, because they are not only deprived from their immunization rights, but they also have deprived from their educational rights. And they are the most sensitive who get influenced by any such change in the culture, in the society. So basically others can cope, but children could not. So what we can do for them is basically to provide them vaccines which are safe and effective, and just prevent them from vaccine preventable diseases, so that we could contribute something to mankind. So coming back to this second question, apart from this, for the first question, if this COVID peer hub was not available, we could not be exploring such wonderful ideas and could not enlightening and broadening our views and action plans. So that would remain incomplete. So thank you, COVID peer hub, for providing this wonderful platform where we can together just contribute in developing a proper, handsome plan of action that could deal this challenge of COVID-19 peer hub. So for the second question regarding the continuation as a participation in this peer hub, I would definitely say, why not? So yes, from the core of my heart, I would be available and I would be love to just participate, and definitely would want to just materialize all the actions plans, whatever we have developed, and let's move from plan towards action. So regarding the third aspect, the challenge which I chose is basically the drastically went down immunization coverage in the province Punjab, Pakistan, which is 53% of the total country, which is 5th largest populous country of the world. So the goal which I set is basically, we have done a lot to improve the immunization coverage. So we really want to at least sustain, if not improve, this immunization coverage and achieve FIC to at least 90%, what we were actually eyeing before this COVID pandemic. And not only that, the other area which has affected the most is basically surveillance. So in the surveillance, on the one hand, we are having a decreased immunization coverage. On the other hand, we are having drop in reporting rate. So if we have a poor reporting rate, poor surveillance indicators, very well, we would be missing a lot of cases, and not just the cases, we would be missing outbreaks. And if we are missing outbreaks, we would be unable to respond to those outbreaks. And resultantly, there would be many more deaths, which we are not expecting right now. So both the challenges are important to deal with it, increasing the immunization coverage, but at the same time strengthening BPD surveillance so as to pick sporadic cases as well as outbreaks and to respond them accordingly. So regarding actions, the biggest challenge which we were facing is decreased supply of required number of vaccine doses. So what actually we did, we just put our exact demand, not only for the current month and for the coming months, but also for the backlogs and for the defaulters. We calculated exactly, and we put our request and demand to our national level and provided them our share as far as finance is concerned. And we are regularly following it up. And in this way, we are ensuring maximum supply, whatever is available in the country, we could get and immunize the children accordingly. So this has already been started implementing. We have already forecasted properly. We have received enough share by which we are covering not only the current target children, but also the backlogs and defaulters. The second action plans which we developed is basically to continue immunization services, fix and outreach during this COVID pandemic by following appropriate COVID precautionary measures, at least for hand hygiene, like using sanitizers, mask mandatory, and then social distancing. So what we actually observed, the community resilience and reluctance has converted into acceptance once we have assured them that, look, we are taking all the precautionary measures. Look, these vaccines are really important for you and for your children. So that's why the people are turning around and our coverage rate is increasing day by day. So that is just one. And apart from that, we also like try to build the capacity of our frontline workers. And we have trained in excess to 4,000 vaccination staff during this COVID pandemic to provide proper immunization services and vaccinate the children. Apart from that, we also like try to start capacity building of the surveillance people, especially the district surveillance coordinators. We have completed capacity building of all the 42 district surveillance coordinators from Punjab province who are contributing heavily in improving and the reporting rate for measles and other VPDs so as to pick cases. And they have not only picked cases, but I really want to acknowledge they have picked up at least 12 small scale outbreaks for measles, which we have adequately responded during this COVID pandemic. And the outbreak response immunization coverage was more than 95%, which was really satisfying and satisfactory. So this is just one. And then coming back to the other action points, we have also looked around the corner on demand generation aspects. We have developed small SOPs, guidelines, and brochures, pamphlets, and other such materials. And we are regularly like using it from different media, electronic, print, and social media. And we are trying to like convince community to vaccinate their children because that is really required in this time period. So thanks to Allah Almighty, and luckily Pakistan is just getting better and better day by day in this COVID pandemic situation because of good strategies and implementation from the government of Pakistan. So thankfully, and the partners are like chipping in. So as this situation is improving, the coverage is directly proportional to the improved situation as far as COVID is concerned. So basically, we are improving a lot day by day. And another thing which I really want to mention as far as actions are concerned is basically enhanced outreach activities, EOA. We are exactly getting the defaulters in list for the first time in the province. We are getting those lists from the vaccinators. We are collecting them at the town level, district level, and finally at the provincial level. And then we are like estimating what are the exact defaulters we have to vaccinate. And for that, at least we have figured out the highest problematic districts in the province, which are at least 11 out of the 36. And these are mega urban districts as well as the rural areas which are affected the most. So we have regularly conducting this enhanced outreach activity in each month during this COVID pandemic. And this has resulted in improving immunization coverage. So thanks to all the partners who are just chipping in, Gavi, WHO, UNICEF, and BMGF, who are providing immense support for this platform. So I believe that since we have started improving immunization coverage, so it would be just a matter of a couple of months that we would be able to return back to the normal situation and return to that level where we have left. So lastly, I want to give a tip to all the scholars that since we have a unique position in our official working, most of us are already working as a technical people in some position or the other at the national, provincial, or even the district level, or at the health facility level. So we are probably the right people who could be like contributing in the development of plan of actions. And in this way, since we are like directly contributing development of plan of actions, so we could like suggest them whatever we have gone from this ideas engine and from this COVID peer hub, and that could be like applied in actions and we can get the desired results. So I'm doing the right practice, and now we are also like putting all those things in our programmatic plan of actions, and we are convincing donors and partners to get the required support. And luckily we are getting it. Thanks, over.
Thank you. Thank you very much, Mohammed Imran. And I'm glad to see that most of all of our presenters today actually spoke about already taking action. So they didn't limit themselves to drawing up an action plan and thinking about implementing later on, but you're already taking action on the field to improve upon immunization performances. So I see there are 5 raised hands here, and I just want to, we may not be able to take everyone today, but remember, as Reda said, we'll be having the daily lightning bulletins, and you are invited to come and share your experience with us. You just need to indicate, and we'll be delighted to invite you. So Reda, I don't know if I could take just one last person before we move ahead.
So we have just 5 minutes left, so it'd have to be a short presentation. I want to acknowledge the quality of the comments, both in the chat and on Facebook. There's some really, really wonderful comments being shared about what people have made of this experience of the Peer Hub. But let's go with one last presentation. And as you said, yes, starting tomorrow, you'll be able to join us on Facebook. If you can join us live, that's great. We look forward to your questions and comments. If not, you can watch, at your leisure. We'll try to give the specifics of the topic that's in the ideas bulletin, so you can decide, is this something that's actually relevant and interesting to me, so we don't so you don't end up just listening to people talking about things that are quite far removed from what you are doing. Back to you, Charlotte, to pick the final presenter for today.
So I'm going to invite Winifred Mungai. Your hand has been raised for quite a while now, so if you can just unmute yourself, and you have just a little over 2 minutes. Winifred? Okay, so I'm just going to, there is Abiola Abdul. So the first person to be able to unmute, you have the floor. So good evening, Abiola Abdul.
Yeah, good evening, Ma.
Good evening,
everyone.
So unfortunately, we just have to take one person. Yes, so please, Abiola Abdul, can you go ahead? You were first to unmute yourself.
Okay, thank you very much. Can you hear me, please?
Yes. So please go ahead.
This is, okay, thank you very much. This is Abiola Abdul from Nigeria. I'm an independent consultant to Society for Family Health and Catholic Relief Services. Basically, our job is regional, and in the recent time, we've actually been held due to this pandemic, COVID-19. But back home, because my state is Lagos State, and I've been watching the activities from my state here, my constituency. And I want to write on the comments of every other person, every other speakers that have spoken, earlier before me. I want to commend every effort. I want to commend every participation. And indeed, I want to commend all the speakers, starting from Reda and you and every other person. Thank you very much. Now to my question now, what has changed? A lot of things I must say have changed, because particularly in my country zone here, my team lead, the vocal person, and every participant here in my country, they really made everything easy for us. The level at which we interact with each other on a daily basis, it seems though as if we are in the same classroom. And it's everybody, we are so comfortable sharing ideas with everybody on a daily basis. So I want to give kudos to everybody, the Nigerian team. Also, I want to thank all our alumni. They've been so supportive, very, very supportive on a daily basis. They in fact, they've been the one standing on our neck, trying to urge us, trying to encourage us, and that has really panned out well. Thank you very much, all our alumni. And of course, why not? I would love to continue with the Peer Hub. It's given me great experiences, and I'm willing to learn more, and also I'm willing to share more ideas, and also my challenge. Honestly, for me, my challenge has always been my motivation, because my challenge is to make sure that every person is aware of the immunization, even during this COVID-19. So my challenge is basically to make sure that everybody is carried along. Everybody is they are willing to come out for immunization for their children. We want to believe that every life of our children matters. So we are not really leaving any stone unturned. So my challenge is making sure that the information gets to especially those people in the rural environment. Some of these people, they are limited. They don't have access to internet. They don't have access to communication. So together with my team, I've moved to my action plan now. together with my team, we will try to make a door-to-door campaign. So we try to encourage them, we try to sensitize, we try to educate them on this pandemic, and we try to encourage them that they should come out for immunization in every designated clinic, health centers. And thus far, it has really been productive, because the turnout, on a daily and a weekly basis has been very, very productive so far, and that has really helped. And again, the next question is, I think I've mentioned that the concrete plan is to make sure that everybody, and how do we get that? We make sure that we go to door-to-door campaign, not neglecting every other social platform. So we also make sure that we harness every available platform. We go on here, we go to our local community. We also harness different groups that we have, so as to make sure that we carried everybody along, and we make sure that every lives matter, especially for immunization. I don't want to waste much of our time, because I understand our time is limited. So thank you very much for giving me this opportunity. Over to you. Thank you.
And thank you very much, Abiola Abdul, for taking upon yourself to share your experience with us. I think our time is up, but I want to thank all those who have been leaving very insightful messages on the chat. And I'm just going to hand over the floor to Reda.
There's
with
one
this
last thing.
Comment
yes.
from Olofumi Lola that say, awesome hearing the rich presentations. Thank you all. So thank you, everyone. Over to you, Reda.
Great. There's one last thing I'd like to ask. There's still a bunch of people on Facebook, and right now we only have 183 thumbs up and 121 hearts. So if you thought this was worth attending, and then please add some hearts and some thumbs up to show this. This will be one last round of applause, and then we'll complete today. But remember, the next 2 weeks, we're going to be celebrating everything that you have been doing for the last 6 weeks. So look forward to seeing you in the Facebook chats, in the other activities. It's going to be light. It's going to be fun. Even though we are facing a pandemic, building bonds of friendship as well as collaboration is super important. One last round of applause. And please don't be stingy with the hearts and the thumbs up.